So before we get started, for the folks that are out there that are listening or that are watching, may have heard of
Yes,
endometriosis
yeah.
and have no idea about it,
Yeah.
right? Or maybe even have a family member that might have it and want to know more. So I guess ultimately the question is, if there was one thing that you would want that person to understand, whether it be male or female, male because they're living with somebody that is experiencing it, or a female that maybe is just learning that
That
that's
they
what
have.
that they
Yeah.
have it,
Yeah.
right? But what would you tell that person or those people?
I would probably say that while you may have been going through things that you probably had no idea what's going on, and it was probably been a long road, it might continue to be a long road. It's a journey, quite surely, to get a diagnosis in itself. Hopefully, I mean, there's luckily been things that are making it easier to figure those things out. Like I know they're exploring blood tests and things to make it easier to diagnose. So people don't have to go through, well, multiple doctors to figure it out. That way
Right.
it makes it more accessible for doctors to test it easier. As long as you keep trying with your doctors and advocating for yourself. Advocating for yourself is definitely the biggest thing, because it's so few and far between that doctors are easily answering to what you're wanting to get done, because
Right. Yeah.
there's definitely a doctor, like a gap with doctors
Right.
that understand that we have something and it may not be psychosomatic or whatever it may be, like what they think it is. It's something that we know it is.
Welcome back to Average Joe. Let's talk about it. This episode is going to be a little bit different than what we normally do here. Usually we're talking about growing up, nostalgia, music, life experiences, or whatever happens to be on my mind that week. But every once in a while, there's something that deserves a bigger conversation. And this is one of those things. In this episode, I'm sitting down with my daughter and having a conversation about a condition that impacts women all over the world. A condition that doesn't get the kind of attention or care it rightfully deserves. The hidden battle within that we have come to know is endometriosis. She is currently living with stage 4, which is the most severe. And instead of me reading statistics to you for an hour, I thought the best way to get a better understanding was pretty simple. Ask her. So that's what we did in this episode. But before I send you on your way, you got to know that obviously we know we're not doctors. We're going to talk about some basic medical information throughout the episode, but when we talk about symptoms, diagnosis, and treatment, we're primarily talking about her experience. This isn't medical advice, but if somebody hears her story and recognizes something they've been experiencing themselves, maybe it gives them a reason to start asking questions. So let's get back to it. Overall, I mean, I think what I understand is you could break it down to like 3 different sections, right? Doctors who are asked to treat this, right? And have a better understanding of it. And then you have the loved ones that may, have somebody in their lives that are struggling with it that they don't understand, right? Because
Yeah.
it is just not something that's out there. Everybody hears cancer or diabetes, and there's so much information out there about that kind of stuff. And that's easy to understand. That's easy for the common public to get behind, where endometriosis is a different story. So,
It's
whether
not
you're
as
in a
visible.
relationship with somebody
Yeah.
that has no idea, right? And then you got to kind of, teach them, hey, this is how my body works. This is who I am, right? And this is not just going to go away because it's not curable, right? And then of course, for the young women that are out there now that are probably just, kind of coming into their own and saying, hey, there's something going on here that I don't understand. Could this be it? And if so, what do I do about it? So that's kind of what we're going to get into as we go through this interview and talk about some of those things. But yeah, I think you're right. I think there is a lot of misconception. There is a lack of
Yeah,
understanding,
there's
right?
not a lot of education behind the disease itself. Like we're there, we're lucky to have the doctors that we do have that know as much as they know about it, and have done their research and have done their work behind figuring out what this disease does and how it works and where it comes from and what it's going to do to the body. but there's also a lot of doctors that have absolutely no clue about
Right.
it.
Yep.
Like I've met doctors who have probably asked me to explain what the disease is to them. I'm pretty sure I might have, I think my general surgeon for my appendix surgery
Had to be explained to on what
yeah,
exactly was taking
yeah,
place. Why are we doing this appendectomy?
yeah.
I mean, a lot of times, general practice doctors and surgeons who don't deal in, invasive conditions like that.
Yeah,
And
more intense diseases
and I
and
know that we like,
conditions.
and I don't, is it really a disease though? I mean, or is it a condition? Is it, because when I think of a disease, I think of something that is transmittable. I don't know. I guess it could be hereditary. I mean, you could look at it as a disease. I just feel like that we're putting that label on it, and it should be more. It should be more. I don't think a disease like breaks it down. And I think when
Well,
people think disease, they think something completely different than what you're going through.
I agree. I watched a video the other day of, I don't remember the creator's name, but I think they have one that's based on endometriosis and everything. They described it as what is it? A non-malignant cancer is the way that they put it, in terms like that's what they think it should be called in terms of
Right.
the way it works.
Sure.
Because
yeah.
it can attack so many different
And
areas. It's spread,
right.
like the way it spreads, the
It's
things
hard
that
to
feed
eradicate.
it.
Yeah.
You can't necessarily get rid of it with one certain thing. Hormone therapy it helps, but it doesn't, cure it or anything like that. So it acts in the way a cancer does, but it's not necessarily malignant or lethal in the way most cancers are.
Right.
So,
well, let's go back to the beginning, right? Your experience. When did it start? Like how far back can you remember thinking something isn't right with my body?
I mean, I would probably say around like not very long after I started having a period is when I kind of realized like something wasn't necessarily right. Cause I think I don't necessarily, I think I had my period when I was, I want to say 12, maybe.
We were in Chicago.
Yeah,
right?
we were in Chicago. I might have been 11, but I'm pretty sure I was 12. And then not very long after that, mom was finding something to, like, we did birth control eventually because that was the only thing that would help my periods at the time.
I mean, obviously not. But like, do you think that you and mom came to a conclusion that, hey, this could be endometriosis?
I don't think we knew that early on, because I mean, even then, I don't think either of us had heard of it when I was like until like I was like 14 or 15 maybe is when we probably found out like the word, like even the condition itself.
I'm
but
really
we knew
surprised
something,
because Grandma Bonnie's got it as well.
I think just in that initial point, we didn't think that we weren't sure what it was. And we didn't have a doctor that was able to tell us like, look, this is what it is.
Right.
And we couldn't, there was no way for us to get an answer specifically for it. I mean, we had assumptions. I'm not sure if mom ever maybe thought of it. I don't think I ever did, because I hadn't heard of it until I was told, like a little bit before I was diagnosed and got the surgery.
So
to
before
get
that,
I knew something was up. I just didn't know.
Did you think maybe it's like, hey man, I'm just having a really terrible period. I'm one of those girls who have the worst pain during menstruation that you could ever have. It's so funny hearing these words come out of my mouth. But yes, like that's a lot of people that think that way. And
because that's what I mean, I think it's just what we've been, told constantly. I think since there is such a misconception behind certain, and I mean, it's not just endometriosis too. I know like Jordan from back when we lived in Mississippi, she has PCOS, which just got reclassified as something else because it's much more than that. She also like she has similar issues, like just being told it was a bad period, because that's just what doctors say, because they don't want to look further. Either they don't want to look further into it, or they genuinely don't have any other explanation for it other than that.
A little bit of everything. I mean,
yeah,
your first,
it's sprinkle, a little sprinkle of everything.
Your first go-to is probably, you know what? I don't think a man should be treating this because they just don't get it. And I need to go find a primary care provider that's female
Yeah.
that might have an idea, but that's not always the resolution either,
No,
because
no,
it's
not
just an
necessarily.
education
Yeah.
problem too.
Yeah. Because there could be a female doctor that knows way just as little as a
Right.
male doctor
Right.
could as well. So, but I think it definitely ranges with people. There's definitely people who just genuinely don't know, and then there's people who are a little bit more negligent in the process of those kinds of things, just because unfortunately we have doctors like that nowadays.
We could have a whole podcast just
Separately about that one.
the medical care that people get, and even more so, and we're going to get to it anyway, is the equity of care that women get, right, compared to men. And
yes,
women just deal with way more things than men do overall anyway, especially because your reproductive systems are so complex. We just show up.
Yeah, no, and it's unfortunate because there should be more research behind a lot of different women's health things that aren't as researched as much as they probably should be. And I know that there's plenty of different other aspects that you can go on and on about that relate to all of that. But yeah.
So when it comes to the pain, right? And I'm sure your tolerance level has gone up in all the years you have been dealing with this, to the point where it's just now it's there, and then when you have a severe flare up, it's probably just debilitating. But even as a young kid, preteen, young teenage years, like, how bad was it? Like, how could you describe like what kind of pain it was?
I remember a few times, like even being in school and being like, there's a few very specific instances I can remember, but the pain was definitely still really, like, really bad. Like it took my breath away a lot. Like that's what it really did. It felt like I was getting the wind knocked out of me.
Was it like a continuous pain, or was it just like a sharp, like, punch in the stomach type, or stabbing in the stomach type of pain?
Yeah, it's kind of like a stabbing in the stomach kind of pain as well. But it holds. It definitely, it depends on what specific pain you're feeling, I guess, because there are different pains you can feel. But I know, like, there was one time being in school, I think I was in like a gym class, and I think we were walking around and I could not, I was hunched over in pain. I think one of my friends ended up having to walk me to the nurse because I just could not get back up from where I was at, because I was almost stuck in like the position because of how constricting the pain was, like contractions, which
you were afraid if you moved it would make it worse.
Yeah. And that's definitely, that happens. Even now still sometimes where like I'll get certain pains and I'm like, I'm just gonna stay right here and not move and wait. Luckily I always have like a heating pad next to the bed. I keep it plugged in next to the bed all the time. I don't have it on all the time, but I keep it plugged in, and that's I make sure that's near me.
We always, I think you and I were always fighting for it because it was either my back or your endometriosis.
Yeah. Between the two. And there's also, there's other times too where it's been like, I know like when I was a kid, there was a time at home where mom found me in the bathroom because I was just sitting there and then crying because I was in so much pain and I couldn't walk. I didn't want to walk back to my room. And I had crawled to the bathroom in order to get to it because I felt like I was going to throw up, I think, from the pain. And then I just sat there. And then I think mom heard me in the middle of the night and like came and checked on me and walked me back to the bed.
Doing the mom thing.
Yes, yeah.
So let's explain what we're actually talking about, because somebody watching may have heard of endometriosis, yes, but really has no idea what that means. And so for me, right, just doing the research that I've done, the basic explanation is that endometriosis is a chronic disease, right? There's the word, where tissue similar to the lining of the uterus grows outside of it. So it's obviously in a place that it should not be in, like we made a reference to. It kind of operates in the same way that a cancer does.
Yeah. And it causes, I think the main things that cause the most ailments in it is like it causes like lesions and adhesions is what they're called. That's what causes like things to stick together. So I mean, you'll have a lot of people have cases where like an ovary will be stuck to like the uterus, or the fallopian tube will be stuck to the uterus, or in some case, and those things are what causes it to stick, and those are what causes the pain too, because the way it pulls on things.
Right.
And I guess, and it's a working system in itself. It produces its own, you know, it has its own like blood, not blood supply, but it produces its own estrogen. I know that.
Right.
I've learned that from
I always
doing
thought
my own
it
research.
fed off of it though.
It does feed off of other estrogen. So like that's why one of the treatments is
birth control.
Birth control. Eventually, if it gets so bad, and you know, and if you don't end up wanting to have kids or something like that, that's why they'll do a hysterectomy, because once you take the whole uterus out, you're not shedding the lining,
or
so you're
producing enough estrogen to worry about it feeding off.
Yeah, well, and it doesn't. Yeah, it just doesn't feed it as much. I mean, you'll constantly make as a female, you're going to make your own supply of estrogen at some point, either way, with or without your uterus, but it takes the levels down a drastic amount.
Hysterectomy is kind of like an extreme measure to eradicate it, and it's not even
a cure,
right?
Or anything,
it's not even 100% effective for a lot of people.
No, yeah.
And so I think that in itself is crazy, because some people just can't even deal with the pain, and they've got to balance their life. They got to balance their womanhood and the idea that, hey, do I want to start a family? Am I able to start a family with the condition, or however severe it is, you know, depending, right? You know, to carry a child to full term, even, right? Without worried about risks. Right?
Yeah.
And so people will go the extreme side and say, listen, you know what? I've made this decision. I cannot handle the pain anymore. I'm going to do away with it and hope for the best. And, you know, and that's tough, because, you know, you want to have children, you know, your biological imperative, so to speak, is to reproduce.
It is, you know, it's inherent in all females to want to have they have a motherly instinct. Everyone has a motherly instinct that's a female.
Right. So, and you want a family. I mean, you want to have kids, you know. Kids are great.
Yeah, so, they are. They're great little cute beings.
So when doctors explained, if they even did, right? So I guess the real question is when you had a doctor give you an explanation after you were diagnosed, what did they tell you? Was there even a good explanation, or it was just kind of vague?
Well, I think I got very lucky with the doctors that kind of, because I had two doctors that worked kind of hand in hand to get me a diagnosis, because that's when I was at Mississippi State University. Mm-hmm. And they have the university doctors on campus there. And the doctor that I saw, bless her heart, I can't remember her name for the life of me right now, but the doctor that was there, the female doctor, she was amazing. When I told her all the issues that I was having, and like had told her that I had been going to other doctors and I hadn't been able to figure out what the issue was, she did every test under the sun that she could in that tiny little university clinic, and to figure out what was wrong. And when she couldn't figure out what was wrong, she said, look, I have an inkling of what I think it is. I know she's the first one to say that, said endometriosis to me. And she said, I'm going to refer you out to the clinic that was the Starkville Women's Clinic that was right off campus.
Right.
And Dr. Fike there, she's the one who did my surgery and everything, and she told me, like, she's like, look, with like the history of your, really, like with the cramping that you've been having, the nausea, like that gets really bad, and the pain and everything that I had been describing. Now she didn't ever find with the test that she could do any cysts or anything, but she suspected that I had probably gone through a series of having cysts before, because most cysts you can have and they'll go away on their own. I mean, they'll be painful while they're there, but most can go away on their own. If one ruptures, you'll know, and it'll be painful. And that's what a lot of women will end up in the ER for, with a rupture,
like a cyst.
Yeah, of a cyst. Yeah.
When I think about endometriosis, I mean, this is what I envision, right? I envision this like this weed of,
Yeah.
like have you ever seen those textbook about the nervous system, and
Hmm.
that's all you see, or the circulatory system,
Yeah.
and you don't see anything else, nothing skeletal, no muscle.
Oh yeah,
It's
when
just
it's just like
it's just
like
this
the veins or
branches and all
anything.
that. That's
Yeah.
exactly what I pick endometriosis is like just climbing its way through you like that.
Yeah, and it's very, I mean, it's funny that you say it because it is kind of like web-like. It is like it spreads like a web in the way it looks. And I mean, well, it looks so many different ways, but that's definitely one of the biggest things is the way it spreads. I
I'm
mean,
really surprised that it took as long as it did for the E word to appear, right? And it is a
yeah,
diagnosis, right?
yeah,
Because there was a lot of, I think, a lot of conjecture on like, hey, maybe it is this, but nobody would actually say it for sure. There was no committal to a diagnosis, right?
yeah,
I mean, because if you think about the time that it took between you first experiencing that type of pain and then to getting the surgery that you finally got to get rid
yeah,
of a lot of it when you were in Starkville.
yeah,
There's a gap there. There's like from 2012 to 13, 14s in that area right there
yeah.
when you first started having those issues. And then, we went to Hawaii and we were there for 3 years. And then, you started school a year after we got to Mississippi. So we're talking
Hmm.
like 5 years or
Yeah,
6, maybe even dealing with this before you got to that point where they said, hey, you know what, this is what it is. We're going to dig real deep. We're going to find out for sure. And then we're going to do something about it. So prior to that happening, like, what was it like? I mean, did things change? Was it kind of, I don't know, did the pain kind of lay off a little bit during your high school years prior to moving from Hawaii to Mississippi? Do you remember?
I mean, so I know like when I was first put on birth control, I think it did make a difference at first. I think it did help a lot. And I mean, I was grateful for the time because it's very strange because I feel like there was times that it worked well and there's times that it didn't because but I also think it depends on the kind
The
of
brand,
yeah, the
right?
brand and everything because I also I mean we know I struggled with finding a birth control that
That
didn't
didn't make you
cuckoo
cuckoo.
crazy, yeah, because
Right,
I mean
because
I
that's a
definitely,
hormone imbalance situation, right?
yeah, and you're adding hormones to a situation
And you're
that,
trying to suppress, your body's estrogen creation to
yeah,
calm down this it just it acts like this virus or this weed every time I think
yeah,
about it. But it's
no, yes,
it's
it does,
serious
yeah,
though. I mean, it's
no, it
like,
is, yeah,
no, you're sacrificing one thing for the other, and it always seems to be like your reproductive system versus the pain and this struggle that you have to endure. It's like you're balancing these two things, and that above everything else to me is probably horrible. So, like, if you get
yeah,
into that side of it as an a you know in your 20s now, right? And you're at that age where you start thinking about those things, and you've probably, and I know you've been thinking about that kind of thing for a minute now.
yeah.
What goes through your mind when you're thinking about, hey, I have this thing going on with me. What am I going to do, when it comes, how is this affecting you emotionally or mentally? Are you just trying to like take care of the pain situation and get it under control, or are you actively working towards the goal of being able to have children without risk and without future issues?
Yeah, I mean, I've definitely, yeah, I mean, yeah, I've been thinking about this for a while now. I mean, I was very close to trying to pursue the IVF and everything.
Hmm.
And I mean, if I end up having to do that, I won't be upset if I end up having to go the IVF route, but I would much rather prefer to like try and do it as naturally as possible. But I don't know. I think about it a lot. It worries me that I won't be able to conceive naturally as possible. If I end up having to need help, I'm going to do it anyways and hope for the best.
Sure.
But it is something that frequents my mind often. There is times where I worry that I won't be able to have a kid and that I won't be able to even like carry the baby myself because
Right, right.
that's what I'm most worried about because would really love to do that. I mean, that's an experience in itself.
Sure.
Carrying a child and growing it yourself. It's a deep connection that a mother has with their child. So, and I want to be able to experience that. And it is it's a question mark, you know,
Right.
it's not really something that I can put my thumb on right now that I know for sure is going to be able to happen. I've been told by multiple doctors that, oh, you're young and everything. And I mean, like, granted, I may be young, but I know what this disease does to women's reproductive system in terms of being able to conceive and carry a child. And I know, like, I mean, I was even told when I was in the process of trying to do the IVF situation and I was going to the fertility doctor and everything, like, she told me that there is a possibility of ectopic pregnancy, which is when it doesn't implant in the uterus. It can implant in like the fallopian tube or in the it could completely outside of the uterus,
which is dangerous, right?
Very dangerous.
Dangerous for mom and baby.
Yes, for mom and baby. Yeah,
right?
Because there's definitely, I think there's maybe been like one or two cases where I think maybe it's been okay. It's been very dangerous for the mom. The mom ends up making it somehow, but there's definitely been cases where mothers have passed in that situation and so have the kid. Like, it could either be one or the other or both of them. And it's a situation that usually ends up being asked to be resulted in a medical abortion or something like that in order to, you know, keep the viability of the mother.
Right. Yeah.
You know?
Yeah. I mean, and you know, as the dad, you know, I think about that kind of stuff too, because, you know, I didn't understand it until I started doing research, and, you know, it was just one of those things that I never really truly understood either, and probably will never understand, you know, but I do understand what you've gone through, right? I understand what your experience is. I think just like everybody else, they just need to educate themselves on exactly the mental and or the emotional and physical effects that this particular condition has on women in general, you know? And so, you know, we were talking about different stages earlier, right? There's know, stage 1 through stage 4, stage 4 being the most severe. And did you ever know, like, were you ever stepped up, or was it just straight you're 4? You're, you know, I mean, because
so when I had my first surgery was in February of 2020. And that's when I was told I had stage 1 and everything. It wasn't anything crazy. And then I didn't have the second surgery where I was told I had stage 4 in 2025. So that's 5 years apart. Granted, I wasn't told by anybody that I had gone up like from like stage 1 to stage 2 or stage 2 to stage 3 or anything like that. But I definitely think along the way on my own, I kind of came to the conclusion that it's definitely worse than it was before. Because
so even before somebody said, hey, you are at stage 4, you kind of already had an idea that you were probably there already.
Yeah, I mean, I was definitely like, I remember being told, like, I remember waking up and the doctor telling me that I had stage 4. And like, I went in thinking, probably knowing, like, in the back of my head, I think I knew that I had stage 4, but I was kind of just hoping that I didn't have stage 4, because of course it's one of those things you don't want to hope that you have anything. But I was hoping that it wouldn't, that I was just pumping it up in my head, because I tend to do that. I mean, I tend to think things are further along than they are, or whatever the case may be. And that I ended up being right, that I was stage 4. But I definitely, like, the pain had definitely changed from when I was stage 1. Like, I have a lot more different symptoms. It affects me a lot more than it did when I had stage 1.
Right, because, you know, obviously it's not like stage 4 cancer. There's a complete difference. That's apples and oranges. But
yes, yeah.
But the idea is it's not an increase in pain, so to speak. It's more of an increase of area, right?
Yeah, area
that's affected, right? And so in that case,
things that are all different,
that would kind of double your pain. You know, if you were at a 2, and then all of a sudden, you know, you're doubling. You're going from just being in this area here to coming up into your lower extremities, you know, where your stomach's here, you're in your bowels and intestines, you know, and some very important organs living in there, right?
Yeah.
You know, your
Yeah.
spleen or your liver, your kidneys and your appendix, which you had to have removed because,
Yes.
well, do we know, right? Do we know that it was definitely affected, or we just were trying preventative to get it out of the way so it wasn't?
Well, I mean,
Because it was like they said it was
so
larger.
it was 5 times
right.
the size of a normal appendix. My appendix was 5 times the size. Now, the general surgeon, he said that there was definitely no signs of appendicitis. Like, it didn't look like I showed no signs of appendicitis. I wasn't having any appendicitis pain. Like, I didn't have pain in that region that was related to the appendix at all. And when my doctor, like my specialist, explained it, I think it seemed as more so like she didn't say it outright that like it's from the endometriosis, but she definitely insinuated that it could be from the endometriosis, that it may have somehow either gotten inside the appendix and enlarged it in that way, or if just because I mean it inflames other organs that are around it. Yep. So whether it was probably touching it in some way, shape, or form when it was in my body. So I'm assuming just the brush by of it probably inflamed it, and that's what caused it to be 5 times the size.
Engulfed by this weed, so to speak. Right?
Yeah.
It's just because it's been around it, and
yeah, it's a part of the system. Yeah, it's become. Well, I feel like it's as if it's become a part of the system that's being hurt by endometriosis, so it's affected by it in some way, shape, or form.
And we don't even know for sure.
No, I have
you might have been on the verge of having appendicitis.
Yeah, I could have been right there, and it was getting ready to just pop like a bubble or something, and I just didn't know.
But you just don't know because I mean, everything that happens with your body with that's something like that. You automatically assume because of the disease that's probably the reason. That's the go-to.
Yeah,
and
it's
more
my
often
go-to
than not,
explanation.
it probably is. And,
yeah.
And just to be safe, taking out the appendix, especially when it's 5 times the size it should be, was probably the best idea.
Yeah, I would not have wanted that to stay in. No, that did not need to stay.
So we were talking earlier about, being believed and being understood and going to the right people to get the right diagnoses and the next steps, right? And it's amazing to me that, I was reading up on this to find out that in the world, 1 in 10 women and girls of reproductive age are afflicted with this. And so I think that, and so it boils down to about 190 million people. That's a lot of people that have endometriosis at whatever level that they have at, stage 1 through stage 4. And just like for you, the diagnosis can take years. I mean, we're talking, from the start until when you finally started getting procedures done and
I think it
getting
was 7,
surgeries.
I think it was like 7 years in total. Like, I think that's what my count was.
So I think we talked about the road to get there for the most part, right? So just to kind of go over it one more time, from the moment you said, hey, this doesn't feel right to now, you went through a period where it was kind of, we were medicating it, so to speak, with birth
I was
control.
Coasting. I was coasting is what I call it.
Right.
I was coasting by on it.
And I'm sure a lot of women out there who deal with it where they don't have flare-ups for a long period of time. I mean, it's just with anything with the human body too. We're assuming that, hey, I've got it managed, it's under control, but then you're just waiting for that other shoe to drop.
Yeah.
Right?
Yeah.
And I think, I mean, first off, have you ever been at a point where you thought to yourself, like you truly thought to yourself, I think I have it under control. I think I'm managing it pretty good. The flare-ups aren't as bad or they're non-existent for a period of time where you had some hope?
I mean, I think it would be before I even knew what it was, because technically, I mean, I didn't know when we lived in Hawaii, I didn't know what I had. I wasn't diagnosed. I knew I had something, there was something up, and they were trying to still figure it out. I mean, I was seeing doctors every now and then, not too often.
Were you getting tests? I mean, were they running?
They were, they were. No, I remember. I remember getting tests because that's when I remember before we moved to Hawaii, I was terrified of needles. And then by the time we left Hawaii, I wasn't terrified of needles because
1,000 times.
Yeah, because I had started being poked all the time. So I know that they did plenty of blood tests. I know I'd gotten a couple ultrasounds here and there to see if they could see anything on any of the ultrasounds. I don't think I ever got any like MRIs or like CAT scans or anything down there. I don't remember.
But how effective, though, do you know are getting an MRI or a CT scan as much as like an ultrasound? An ultrasound is probably the go-to for something to try to determine, right?
So yeah, usually it's a vaginal ultrasound. That's the best way to see everything because it's the easiest way to see cysts and fibroids. Those are the things that you can see at least on an internal ultrasound. But if not, I mean, I know that there's some cases where on an MRI you can see it, not on a CAT scan. I know you can't see it on a CAT scan, but on an MRI, I believe is where you can possibly see, I think maybe cysts too. But you can't see like you can't see like the lesions and stuff like that, the things that are causing the things to stick together. But besides that, I mean, it's kind of a coin toss. Like it depends on the person and it depends on the case and how bad it is and what's going to show up that day. Cause I mean, if it's just cysts or if it's fibroids or because there's so many different kinds of cysts too. Like it's not a one-stop shop. Like there's so many different categories of little things that it causes that may or may not show up depending on how large they are or how severe they might be or what area they're in because they can hide too. Like there's plenty of areas in the body for these things to hide and not be seen on these scans because of the position in which they're in. So, I mean, you can have something sitting behind or sitting between something and you won't be able to see it unless you go in with either maybe an ultrasound, which could maybe better see between things, which is typically why I think that's why they usually gravitate towards the internal ultrasounds is because you can see between, but it's also you only get the pelvic region.
Right.
When you do that, like you can't do,
like your abdominal area, you're not getting you're not getting
a good look at it because it's only a topical ultrasound. So like when it's just on like through the skin, like when they were looking at like my gallbladder when I was having the pain in my side, they didn't see anything wrong. They couldn't see anything there, but I was having pain right there. Like that's exactly where my pain was, and they couldn't see anything, and it was very severe pain.
How frustrating is it when you just feel like they don't believe you, right? I mean, do you feel like certain doctors that you had approached about this and seen just didn't believe that you were having the kind of pain or what you thought it was? Because it ends up being you as the individual who are experiencing it has to do the research yourself. You are advocating for yourself. Well, in your case, as a young teen, you had your mom advocating for you, but as a young adult now, you're advocating for yourself and you come into contact with these people where you just want to pull your hair out because they want to go in all these different directions, but what the issue is, but they just don't want to listen.
Yeah, no. And that's definitely like when I had my most recent ER visit, when they did all that, they did like 6 different tests too. I was sat on like this weird bed for like an hour, 2 hours for some sort of scan that showed absolutely nothing. And I didn't like, it had potential to show something, which is why I entertained it at all.
Right.
But
it was new to you. So it
was new to me. Yeah. I had never done that.
Right. Maybe they know something that I don't. Right.
Yeah. I was like, maybe something will show up and see that like maybe.
But once again, it was for nothing.
Yeah, no.
You walk out of there with no resolution and still severe pain.
Yeah. And like, I mean, there was the doctor that I came in contact with there before I had gotten that specific test. She had done the MRI and the CAT scan and, said nothing had shown up. And I had brought up the fact that I have endometriosis because I had brought it up multiple times throughout the time that I had been there already. And I hadn't really gotten much, I wouldn't know how to explain. I hadn't gotten much feedback from anybody saying that like, oh yeah, and maybe let's look into this and see if maybe that's possibly what it is, considering that's something that you have on your medical chart. Like it's on my chart that I have endometriosis, and they did not entertain the idea at all. I had a very lovely nurse that, was tried to advocate for me as best as he could. But, and I eventually said to the doctor when she came in, I was like,
It's
could it
funny that you have a
possibly,
male nurse that's trying to advocate for you, and you've got a female doctor
I know.
who doesn't know what to do.
Exactly. Strange. And she straight up told, she's like, if it would have shown up on the MRI, if it was going to be on the MRI. And I was like,
Not
quite
really.
unfortunately, you don't know that it doesn't always show up on an MRI. Like I tried to ask for some sort of gynecological specialist, or even just just a regular GYN doctor, if anything. And I was not entertained in the least. Nobody listened to me at all. And it was extremely frustrated. I think I even cried tears of frustration because I was like, damn it.
Right.
I was like, please, like, dude, like listen to what I'm saying, because I'm saying something that's valid. Like I know what I'm talking about here, because this is something that I have, and I've been being treated for this for a good period of time now. Yeah. Right? So I think I would know a little bit about it.
The thing about it is, having something like this, going emergency medicine just does not treat specialty conditions, right?
No, and they've always had a bad
rep
for those.
About triage only. They just want to get
make
to
sure
the root
that you're
of your
going to
pain.
be alive.
Right. They want to keep you alive, and then if it gets to a point where they got to send you upstairs and make room for you, then they'll admit you. God forbid that you have to do that, but it's unfortunate that you can't get relief right away for this particular affliction. It's just impossible.
It's rough. It's rough. And I mean, even in the cases of like, there's certain times where I'll go for just my pain. And I mean, I don't ever want to seem like I'm like seeking anything, like, because I know that there's probably so many women out there who go to the ER. I think there's women who do go and who do need pain medication, and because they don't have anything else to help with their pain, and quite frankly, there's only so much that we can do for our pain in order to bring it down to a certain level where we can operate on a day-to-day basis.
Right.
And some of us are made to seem like we're pill seeking when we're genuinely just trying to get relief.
Right. And I mean, that's an unfortunate side effect of people out there that are abusing the system.
Yes. Yeah.
Right. Make it difficult for you that have genuine pain issues that might need something for pain management. God forbid. I mean, we don't ever want to do that. I'm against pain management, and I try to avoid it as much as possible.
I try not to. And the only times I've genuinely like gone and asked for pain meds is when it's gotten like so bad to where I can't move or get out of bed. Like if I can't move or get out of bed, then I know I need to go and at least get something to help, get me over the lump of having this exhausting pain that's just it's because sometimes it's just so bad. it's really genuinely terrible sometimes, where, like I said, it takes my breath away most of the time, and like I can't breathe because it's so painful.
So let's shift gears, because we kind of like we're deep into the medical field, having that lack of education, or just the belief and just knowing what to do, right, for endometriosis. But outside of that, right, you still have to live a normal life. You have to go and maintain employment to take care of yourself in order to have insurance and all these things, and deal with people in general, just in your life, right? And the difficult part about that and having endometriosis is the fact that nobody can see what's going on with you, right?
Yeah, invisible.
And
it's the invisible illness.
It's the invisible illness. So people can see you, and you look, right? You put the face on, right? And you may be just like, your pain level might be at a 6. It's manageable. It's tolerable. You can live, you can tolerate it enough to where you can get through the day.
Yeah.
Put a smile on your face, give a chuckle here and there, have a good time to the best of your ability, because you have trained yourself to be able to do that, right? In the beginning was not even close to that, but you get to a point where you're like, all right, I can't not live my life. Right?
Yeah, no, that's definitely something you learn over time. I think anybody with a chronic illness probably understands that kind of portion of a chronic illness of trying to just fight the battle of wanting to be able to live a normal life while still being able to manage what you have going on, because it is such a like it's like a teeter-totter issue. Like, like sometimes, you're up on one end, on down on the other, and sometimes it's not a straight shoot, and it's a tough situation. Sometimes it's really hard to pull yourself together sometimes to really like, fight to have, a social life, or just being able to go to work, or certain things like that. But I mean, in order to make it work, we gotta.
What kind of, I mean, like if you put a percentage to it or a ratio or whatever, like what do you think the balance is between you having to deal with this and not being able to live a normal life like, regular people, if that's such a thing, but
Yeah.
but dealing with endometriosis and having to put the smile on, how often are you living your life versus you're just laid up, you can't handle it for that day, right?
Yeah. Well, I don't know. That's a good question. I think it really just it depends definitely on the person. I mean, I know for me, I definitely have. I think more often now I have a little bit more bad days than good days, like here and there. But I definitely fight to have my good days, man.
Sure, of course, man. We all
I try
we all
to
want to have a good day.
Yeah, I try to battle through, because I know there's some days where I genuinely feel so exhausted, and my energy is completely, my battery is drained, and I don't have the go in me. But I'll try and like help out around the house with whatever I can. I'll try and cook dinner to make myself feel better, or something like that. That's what most recently what I've been doing is, at least if I know, if I can make myself a good meal at the end of the night, and feed myself a good meal, I know I've done something that feels productive for
Right.
myself for the
Yep.
day, and I don't feel like a total waste of time, a
That's
total waste of the day.
That's the emotional and the mental health impact that something like this has on you, because
Yeah.
you want to be able to fight, and you want to be able to fight through it, right? And have a normal day, whatever that looks like, right? I mean, have
Yeah.
you ever been even been able to say, hey, today was a normal day? And what is a normal day for you?
I mean, I guess, yeah, no, that's a really good question. I'm not working right now. When I was working, it was being able to, go through a whole day of work and be able to not like, cause I mean, that was one of my biggest issues when I was at work, is it was so hard to get through the whole friggin' shift, because like quite literally by the end of it, I'd be like I'd be falling asleep almost, because everything, because well, I was also working somewhat of a strenuous job, working with dogs and working outside in the heat, and
Sure, yeah.
constantly moving throughout the day is a little bit strenuous, especially for the condition that I have. So, but I mean, getting through a day of work and being able to come home and still be able to feel like I can still do something afterwards is what felt like normal to me at that point. Now I'm just, as long as I can get up and do some things around the house, clean and do all that, and make sure I have something to do. If I can find something to keep myself busy or help with around the house, I do that. That way I feel productive, at least, because otherwise I just I don't feel like I'm doing anything.
Do you ever have to
Um,
force yourself though to
oh
get to that point?
yes. Yeah, no, there's definitely, I definitely have days where I would much rather just sit down and lay in bed, because I quite literally don't have the energy to do anything else besides maybe sit up
Yeah,
at
pain is
most.
fatiguing. I mean,
It is
it'll drain
extremely.
the it'll drain your system completely, and it's just a poor quality of life.
It is. It brings down the quality for sure. And I think just the fact that, in addition to the pain itself, the condition can drop down. Like, I mean, it drops my iron. Like, I mean, I like my
Sure.
iron
Yep.
levels are really
Yep.
low. So like it takes away anytime my period comes around. And that's not supposed to happen for when somebody has a period. You're not supposed to drop like an extreme amount of iron when you go through it. You may drop a little bit, because obviously, when you lose blood, you're losing iron. But
Well, and that could be completely unrelated, right? It might be a hereditary thing that you unfortunately got from mom, you know. I
Lord
mean,
knows, honestly, but yeah, it's just one of those things where like there's so many other things that it can affect. Like I'm sure like I'm sure my B12 is crap from this. Like I'm sure I
I
don't
got
do.
a whole bottle up in the medicine cabinet if you want to take it with you.
I'll take it. I'll take it.
So here are some things that I've wondered about, personally is like
Yeah.
when when people see you doing like normal things and going to work and hanging out with friends and doing all the things that you are struggling to do maybe, and maybe you're not, maybe you're actually having a good day. I mean, how difficult is it for you to maintain that? I know that you said, you don't want to be to the point where you're so debilitated that you're just laid up because you feel unproductive. And
Yeah.
mentally, that's a strain too, because then you're like, God, I feel like a piece of shit.
No, yeah, you're genuinely,
And like, I got to
that's
do
genuinely
something to
how
feel
I feel.
better, right?
Yeah. Yeah, no, that's oh God, yeah. I mean, there's definitely times where like I'll be out and like I mean, my boyfriend knows, Robert knows, like he'll see it in my face sometimes where I'll be fine for like maybe the first couple hours of hanging out with some friends and I'll get some cramps. Like I'll start cramping out of nowhere for a good like 30 minutes to an hour and I'll be out and want to sit in a corner and just like shut up, don't talk to me.
Right? Yeah.
Let me sit in my fucking pain. Otherwise, just I'm
You're
not
just
going to
gonna
be
will
happy.
it to go away, hopefully.
Yeah,
Keep your distance.
keep your distance, have some fun. I'm going to sit and deal with my sit with my pain for a second and talk to it and tell it to go away. And there's sometimes where it doesn't last as long. Sometimes it's a quick spurt. And then sometimes when I'm out, I don't have any issues at all. It really, I think it depends on what I've eaten in the day, what I've done in the day. I think people with endometriosis always need to keep in mind their limits because unfortunately with a condition like this, we do have certain limits with things. I know that, putting ourselves in extreme heat and things like that, like I know that that's something that can increase symptom not no, I guess not necessarily increase symptoms but have symptoms come on
Right.
being in extreme heat because I know like when I worked at the kennels, like I it got to the point where I couldn't I couldn't be outside in the heat anymore. Like it was too much. Like I could be at least in the area where there was fans and stuff and we had like some air conditioning, which is when I switched to being inside and like cleaning the kennels instead of working outside with the
Mm-hmm.
dogs because I could do that more because I was I'm extremely heat intolerant. So like
Right.
being outside is strenuous as hell for me. Like
Well,
it
I mean,
takes
this disease in itself is an uncomfortable, aside from the pain,
yeah.
right? Even if the pain is at a level where you can manage it and you can get through a day, you're still dealing with it. And so having that pain still sticking with you, it's uncomfortable to have to live with. And then on top of that, you're putting in yourself in uncomfortable situations, right?
Yeah.
So
Yeah.
nobody wants to be in extreme heat because
No,
that's
of
just going
course.
to
Yeah.
exacerbate your already problem that you have going on.
Exactly. Yeah.
And then on top of that, do you think that stress probably makes it worse?
For sure. Yeah, any sort of stress, or it's physical stress, or like physical strain, or emotional strain, like all of it. I think that all has to do with it. I think I've always been a big believer in like your body and your mind are connected, and whenever something's going on up here, it's more likely that something else is going to go down here. So I would not doubt at all that when I'm stressed or I've put a lot of physical strain on my body for a day or something that it definitely exacerbates the situation and makes it worse in some way shape or form, whether it's taking away a little bit of energy or causing the pain to be a little bit more physically straining than it was the day prior or when I wasn't feeling that way. So I think it just depends on the person too though, because I feel like there's some people who go through stress and it doesn't that doesn't have the same effect
Right. Yep.
on their body because everybody's different. But
I think it works probably two ways, like you were saying. One begets the other. So I mean, if you're having an emotional breakdown, that's probably going to activate something in your body, whether it's endometriosis or any kind of pain or affliction
yeah.
that you're dealing with,
Yeah.
right? And then on the backside of that, or on the flip side rather,
pain itself and whatever your body's going through hits you pretty hard, emotionally and mentally, and does really create hurdles to have the best mental health that you can, because you're just constantly in this cycle of pain. Okay, it's starting to go away. Oh, pain. Oh, that's right. Pain. Okay, here it is again. And so that's gotta be tough,
Yeah, I've had a lot of people pride me on my positive outlook on it. I try to be as positive as I can with it and kind of take it all with a grain of salt and boogie it off.
PMA, I call it positive mental attitude, right?
Yeah. Because I rather think about the positive things in my situation rather than the negative, because I don't know, I think if I dwell, I'll dwell too hard. And I don't ever want to make my situation worse by making my emotional health worse.
Sure.
And I know, I've had issues with depression before, and I don't want to get back to an area where I'm super depressed again. And I definitely have my moments where I get really down in the dumps about my condition and my situation and what the future may have and be holding for me, because it is an unknown as far as my condition goes. But I try to maintain a positive attitude as much as possible, because otherwise I'm just going to be miserable, and I don't want to be a miserable person. I don't want people around me to see me as somebody who is miserable. I don't want, like, I'm not a person who likes pity. I don't like people to, like, I'm not a woe me person. I don't like to have somebody dot on me and dote. It's not my style. I am not that kind of person. As much as I think it's a wonderful thing to be taken care of by family and friends and all that, I don't want anybody to look at my situation and instead of saying, wow, I wish somebody could help her. I would rather them look at it and see what can I do to make the situation better or something like that, or things like that. Cause I don't like being negative. I'm not a negative person. I don't like to be a negative person. I like happiness.
Don't we all? So your growth as a person in this situation, right? Because you think about the stigma that goes along with talking about anything of this nature, right? A lot of it's personal, especially when you're talking about your womanhood and all that kind of stuff. How do you think that your journey, maybe first thinking, hey, there's a stigma and there's some embarrassment having to have these conversations, turn into sitting down with dad and having this conversation now, right? Has it kind of grown with you? It's like the more you learn about it, the more comfortable with the idea of what you're going through, versus like if you could remember your 14-year-old self versus your 25-year-old self, you'd be like, you know what? I'm definitely a different person. But how bad was it, or how difficult, I guess I would say, was it to talk about in the beginning versus now?
I think me, when I was younger as well, I think I was always kind of I think when I was younger, I was always a little bit more shy. I was a little bit more reserved when I was younger as is. So, going through something that I didn't really know much about, and I didn't really know how to explain the issues that I had that I was having at the time. It's kind of was something that was hard to put into words, I feel like. So it was just already hard to talk about in itself.
It's not like it's a dinner conversation anyway.
Yeah, no.
Right?
And then
it might be now that we're all adults together, right? You guys are all grown up, but I mean,
and it's such a normal, I think it's just become such a normal thing in our household now too.
Right. Absolutely.
But no, yeah. I think when I was younger, I didn't really know how to talk about any of that probably at all. But now that I'm 25 now, I'm fixing to be 25. So I'm more comfortable in how I speak about things. I'm much more open. I feel like I'm a very open book, even with outside people.
Outside the family, that sort of thing.
No, yeah, I definitely think I'll talk to anybody about this nowadays. Robert, he had one of his friends, we were talking about it yesterday because he brought up something about peptides. And I recently saw something about how peptides is going to be used as they're researching that as a treatment for endometriosis. And we spoke about that, and I was happy to talk about it. He had no idea. He had no idea what it was. He was like, could you tell me what that was? Like what that is? And I had to explain it to him, and I would spit it right off the tongue. I don't really have like a taboo about it anymore. I think I definitely probably did when I was younger, but when you're a teenager in sex ed, you're all kind of hee hee ha ha ha
Sure, yeah.
the
Well,
whole
you're not
time.
mature enough to really
yeah, to have
get
those
it, you know.
conversations and be like,
And even as you
and
get
look at
older,
it in
you
just
can
a way
still
that's
joke about stuff like that.
no,
But
of course, but I think it's just like when you're younger, you have the natural inclination to kind of joke about those kinds of things or kind of shy away from those things.
Mhm.
But now that I'm older, I have zero issue
so would
bringing
you
up
tell
the topic
would you
with
tell like
anyone.
your 14-year-old self if she was listening or watching now, would you say, hey, listen, there's no reason to be embarrassed about it. It is something that happens to so many women that are out there that are dealing with it today and have struggled the same way that you are, you know, like how would you convey that message to that young girl who was you at the time, right?
That's a good question. I would definitely let her know you're going to be confused for a while, but I mean, as long as you know that like yeah, you don't need to be ashamed of anything that's happening because while it may not be normal in your head for right now, it'll become a normal thing. And even though it not necessarily should or shouldn't be a normal thing, it's unfortunately something that
It's
that person,
commonplace,
yeah,
right?
I was
Yeah.
about to say, you're going to have to live with it regardless. It's just, you don't have to think about it too hard. Like, I think thinking about it too hard and not thinking about what it's gonna do. I think I would have thought about it too hard as a kid. Like I
Like
thought about
being
it a
in your own
lot.
head and
Yeah,
all the
all the different
worst
things
things that you start going down the rabbit hole with WebMD back in the day, where it's like,
yeah,
oh,
you just that's.
I got a
I mean, I had
sniffle
the
and now I've
internet
got
at my hands
right,
as a kid. I was
right.
always going at it, and I think when I was so worried about it when I was younger, and I didn't know how to. I had no idea how to bring it up to mom, and I mean, mom eventually found out. I don't even know how. Oh no, I know how she found out. It was a very crazy day that day when I woke up in a pool of my own blood, which
Yeah.
was insane. Like that was
No, I think
that was the first. Like I think that was when everyone was like, "Okay, this is a little."
I remember that day.
crazy."
I think even my mom was there at the time.
Yeah, because she was sleeping in my room. Grandma was sleeping in my room.
You were sleeping downstairs, right?
And I think Aaron was sleeping down there too.
Yeah,
Aaron was still there.
So we kind of had a packed house with visitors at the time too, and so
I sat there for
embarrassing, though,
I
right?
was so embarrassed.
I was
even
imagine.
Mortified.
That's the stigma that I talk about, like because if you think of a young girl who's
I
even
had
mortified
no
by
idea.
having a period, right?
Yeah, no, and I mean,
no matter how prepared you are.
Yeah,
it, right?
well, like I don't remember my first period, like at all. I don't remember the first time I got my period. My memory is horrible with it, but I remember that, and I remember I
It's
knew
unusual,
something was
you said,
yeah.
right?
I was going to say I knew it was unusual. I knew it wasn't like there was something wrong, but I also at the time was like, but is it though?
Right?
like,
yeah, because you didn't know. I mean,
I had no idea for sure, and so I was gonna be embarrassed regardless. We had so many there's so many people in the house that day. I was like, what am I gonna do?
And it's crazy to think that far back. You know, for you, it doesn't seem like that long ago. For me, it seems like a lifetime. But no, I remember that day well because I mean, it was kind of mortifying. You could tell by the look on your face and your reaction.
Oh, I
mean, run upstairs
cry.
and
I cried. I'm pretty sure
it was not a good day.
No, I think I don't know. I think mom did something for me that day to make me feel better, but it was a bad day for me.
Chocolate bar sliding under your door. I don't know.
I think he did give me a chocolate bar that day.
But yeah, I think even mom said that was probably the first time where she started thinking that something was wrong.
Yeah, no, that's my most notable, like that one and the time when I crawled my way to the bathroom, and that was in the same house too. So it was, and that was around the same time as that. It was probably within the same week, maybe. I wouldn't doubt.
Probably, and that's probably why it doesn't feel like it's the same moment. I'm pretty sure that it all happened all in that week.
Yeah, I was about to say, I'm pretty sure.
Like, oh my goodness, here we go.
Yeah, because that's when the pain, like that pain was, I remember the pain from that was horrible. Oof.
So up to now, I've been asking you questions as an interviewer, and while it's all well and good, you know, as your dad, I think, you know, the question really should be is like, what did you wish that I knew earlier? Like you say, okay, do you wish I knew something or understood something about this whole thing earlier than I did?
I mean, I think there was definitely times where I was more, I think, well, the whole journeying with like the birth control and everything, I was so emotional throughout that time. I don't think everybody realized how emotional that stuff was making me. I think I just wished everybody around that, like, I remember thinking, like, when I was a kid, like, I just wish everybody could understand that, like I'm not trying to be this emotional. Like, I'm not trying to have, like, be an issue emotionally or anything. Cause I know I was a tough nut at times when I was in middle school. That middle school, early high school period was.
We just chalked it up as to you're just a teenage girl going through something.
No, yeah. And it was rough. And I definitely had a rough time, but I think you did good. I don't think I think you guys did as best as you could with what you had and what you knew about. I mean, I think you both were busy parents as well. I mean, you were pushing boots at that time. Mm-hmm. So you also had a full plate in terms of work. And I think mom, for the most part, had her bases covered with me in that. So not to say like I didn't like need anything from you, but I didn't expect you to like do anything extra or like take any extra steps. I think you handled everything as gracefully and willfully as possible with me.
I'm glad
you were a good dad. So
I think about, times where, it's like, am I understanding enough, or, am I asking the right questions, or am I leaving you be when I should be, or am I pushing when I shouldn't be pushing, or, those type of things you always think about, in hindsight. And I'm sure there's times, right? I'm sure there was times where you felt like I could have been more understanding, or
I'm sure there's specific
instigating issues, but that's just daddy-daughter stuff happening from time to time. That's going to happen, right?
Yeah.
So okay, I definitely, without even asking, can attest to knowing that I had no idea how bad it actually was, right?
Yeah.
And you've even said that over and over again, and we just talk about that in general terms because I think people uneducated on this subject just don't have an idea, right?
No.
And as a parent, it's super tough. I mean, I definitely felt like there was times I probably could have like sat down and asked more questions and probably, been more concerned, even though I was busy and I was gone, 12, 14 hours a day, there's still time, right? There's always time.
Yeah. No,
so,
yeah.
I do regret at times. And I think about, things that I could have done differently. It's neither here nor there because it's in the past, but if I could go back and do it a different way, I definitely would have been more inquisitive and, maybe not more understanding, because I would allow you to help me gain that understanding if I would just ask more questions about what was going on. So,
well, I mean, everybody can always ask more questions. I think, I don't think anybody should sit on the questions that they don't ask, but just
they
make
might
sure
even
they
know to ask a question.
Yeah, no, of course. But I mean, I appreciate that the sentiment behind thinking you should have, asked more questions. But I think you did real good, Dad.
Well, I appreciate that. Because I think it's important, because especially for dads that have kids who are in this situation, who are wondering, what is my part that I play? What do I need to do to make this easier on my child when you see them struggling so much? And, there's only so much that we can do. We can't stand in front of the doctor and choke him out because he's not listening to our daughters, even though we want to.
Sometimes, man.
But, there are husbands, there are boyfriends, brothers, and friends that, have people in their lives that deal with this all the time. And you just gotta say, hey, you know what? Ask those questions.
Yeah.
Find an understanding. Do the research. There's so much information out there today that there wasn't before, even on this subject, but I mean in general at your fingertips.
Yeah. No, there's literally everything at your fingertips.
We'll never, men will never understand physically what a woman goes through, in this situation, or in most situations, not just endometriosis in general, but just, being a woman specifically, right? I know we joke about that. Women joke about it, but it's a real thing, right? And for something like this, it's like, hey, take the time to ask the questions and be understanding is what I'm getting at. So, what can we do better? Talk, have conversations. Don't be, don't be afraid to sit down and ask some tough questions, or just listen, right?
Yeah.
Listen and believe, right? Mostly believe. I think the worst part about this, probably for you, besides the pain, is just being believed and having people say, okay, we're going to go with what you're talking about because you know more about it than we do, because that's where
Yeah.
we're at, right?
Yeah. Yeah. Unfortunately, that is with where it is at in medicine right now. That is generally the situation that we're in, unless, of course, that person's seeing a specialist in whatever it is, whatever, if it's an endometriosis specialist. So it really just depends. As long as, yeah, and as long as the beliefs behind it, that's really all that, as long as the doctor's willing to listen and take your word for what you're saying, because that's the biggest one right now, I think, for sure.
And so if you were to prioritize what you feel needs to change out there for this particular subject matter, what do you think would be at the top of the list?
Just research.
Like, doctors need to go and actually do work.
Yeah.
Like, don't just say, hey, you know what, I'm gonna wing it.
Yeah, no, all the people that are pushing all the research that's being pushed right now for endometriosis, and to discover, what causes it to spread, what causes it to adhere things to other things, or what causes it to be gone, like what can kill it, or what can, at least bring it down in a certain level besides just surgery, like, in different treatments, different diagnoses, instead of having to wait for surgery to be diagnosed. Like, I want to see research with all of that, because with 1 in 10, I think it's deserving of that kind of research. It's just as prevalent as diabetes. That's the thing that I see the most common is diabetes is 1 in 10, and so is endometriosis. If diabetes can get some research and some treatment, then I don't understand why the research hasn't started as well, or hasn't gotten as much funding as other things.
I just think, personally, my opinion is, I believe that it doesn't get the attention that it deserves because it's not as prevalent as those things we've already mentioned, which I think is ridiculous, because one 10 is kind of one too many, right?
Oh yeah.
You never want to ever be in a situation where you're that one. But the thing about it is, you listed a lot of the stuff that I was actually going to ask if you thought those are priorities, which is research, the education, that sort of thing. And there are even more obscure afflictions out there in the world that you got to wonder, like, how are they being treated? Are they getting the research and the attention that it deserves? And then the biggest thing that is the heartburn for everybody is insurance.
Yeah.
And getting insurance approvals for procedures and diagnoses and biopsies and whatever you have to go through.
Oh yeah.
On so many different levels, and not just for endometriosis, but since we're talking about that, how difficult has the insurance process been in order to be able to get something approved to move to a step that's going to help you?
For the most part, luckily, I think we've gotten really lucky for the most part with TRICARE. They've covered, I feel like, most of our stuff. But it's so strange, because like now my specialist that we had here, like, she doesn't take TRICARE anymore. So like, insurance is ever changing with so many different, conditions and certain things. Like, there's certain treatments that aren't covered by certain things. And if you go in to have like a random check for something, there's potential that that's not going to get covered for it. Like, even if it's just like, if you're not having any emergent situation and it's not going to lead to somewhere else, and it's just a check, they can bill it for something that's way more than what it could be for.
Right. So and what we're talking about is coding. Coding is such a ridiculous thing to
It's the stupidest thing ever.
Like, we shouldn't even be having the conversation about coding different procedures for something that's important, regardless, if it's something that afflicts 1 in 10 people or 8 out of 10 people. It should get the same quality, the same equity of care that anything else does, right?
Yeah, exactly.
So, yes. What do you wish somebody had told you about? If you think about it now, obviously you had to do all the work yourself between you and mom, mostly, trying to figure it out up to this point. But if you had somebody like that maybe you knew that could mentor you in a way to help you through the struggle, like what would you hope that they would teach you?
That's a good question. I think the biggest thing I think right now would probably be, well, not just right now, but like in general would probably be like when I first had my first surgery, when I had that first surgery, I didn't know that there was like a golden standard surgery. So when I got that first surgery, I don't even know if you know this, it was ablation. So which is when they
I know, yeah, definitely that it's been offered to me, but yeah, go ahead.
Yeah. It's when you burn the tissue.
Yes. It's not fun.
No, it's horrible.
Right.
It was painful. I mean, like I did that surgery. When I recovered from that surgery, it was horrible. But that's what I had done. And that's not what you're generally supposed to do for. Now, granted, I loved the doctor that I had down there. But she clearly, yeah, I was about to say, but she clearly also wasn't as educated as some other doctors who know that, when you do that, it makes like it kind of ruins fertility in a way. Mm-hmm. So that's something I learned. It's very, very, very bad for the lining of the uterus and everything. So it makes it, usually people who have ablation done to the uterus end up having a harder time conceiving. That's why I think when I read about it, I think it said it's usually done after somebody's already conceived. And then like, I wish somebody had told me at that point, or somebody had told her even that that's not what she should have been doing. And she should have been doing excision, which is what my second surgery was. Now, granted, that one was way more painful because they're pulling it out from like they excise it. So it's pulled out from however deep it is. So if I had, which I did, I had deep infiltrating endometriosis in certain areas of the uterus. So it's pulled out from however far down it goes in. So like if it's, if my uterus is however, thick and it goes all the way down to the bottom of the skin of it, they pull it all the way from the end.
Good grief.
Yeah. And that's the standard of care because it removes the whole root of it rather than just the top half of it. The top layer of it is basically what ablation does. So
you're not mowing the grass, you're digging up. You're
digging up the turf. So, and I didn't know that when I got it done at 18. I was 18. Mom didn't know at that time. We both didn't know that was what was supposed to be done. We just knew that I was getting some sort of treatment for the pain and issues that I had been having, and it was the next best thing for my relief. And I don't even know, like at that point, that we even knew about half the crap that we know about now.
Well, you had high praise though for the Starkville doctors.
Oh, I love her. She was still, I love her. I bet you she knows a lot more now than she did before. And I bet you she probably doesn't do the ablation anymore. And she probably only does excision if she does it. If not, then she probably hands the cases off now. But either way, I'm still grateful for the treatment that she gave me, whether or not it was the standard of care at that time or not. Well, because it still helped my symptoms. Yeah. It's just, I mean, granted, I don't know what the repercussions of her doing that had on my body necessarily, so to speak. But I mean, I would hope nothing crazy. But you don't know until it happens. So. But I still pride her as a great doctor. She was an amazing doctor. She was extremely kind. She was a very good listener. She did her best to try and figure out what it was. She was the one who pushed for the surgery and everything and let me know, like, this is what we should do. I think you have this. And lo and behold, what did I have?
Right. And that's good. And for all you doctors out there listening, right, take notice, because there are doctors out there who pay attention, who listen, who believe. If you made it this far, I'm going to ask you to do something a little different today. So yeah, sure, you can like the video, you can subscribe, you can follow the show, whatever. But that's not what we're here for. I appreciate every single person who does, of course, but that's not the most important thing I'm asking you to do with this episode. I need you to share it. Send it to somebody who needs to hear the conversation. Maybe it's someone dealing with unexplained pain. You have no idea what to do about it or where it's coming from and why. Maybe it's a father who doesn't quite understand what his daughter is going through. Maybe it's a husband or a boyfriend, brother, friend, or a coworker. Or maybe it's someone who's been dealing with endometriosis for years and just simply doesn't know that somebody else understands. And if you live with endometriosis and you're comfortable doing it, tell us your story in the comments. How long did it take you to get diagnosed? What do you wish people understood? Because the more people talk about this, the harder it becomes for this disease to remain invisible. Before we wrap this up, thank you. I'm super proud that you were able to share your story. I think it's important for young women out there who probably don't know what they're dealing with at this very moment to maybe get a better understanding if they get a chance to watch this video. Hopefully this gets shared enough to where we can create this this call to action, right? To get more doctors out there, the education that they need to understand how to work with somebody instead of looking at something in black and white. And I don't know this because I'm not a doctor and I'm not trying to say that I am, but I will say that as a patient who has been treated by one, and as a family member who's had somebody in their life that's had a difficult struggle trying to get treatment, I can tell you that it's something that we need to put out there into the world. So I'm super proud of you for coming and doing this. And hopefully we can get a good push to get this out into the world and get more people educated. I know there's a lot of content on it, but you know, the more we get out there, I think the more people are going to kind of gravitate like and ask the right questions.
Yeah, no, I agree.
If I can get one dad out there or one brother, one boyfriend, or even one doctor, more importantly, to say, hey, you know what, maybe I need to think twice about how I'm treating this person, whether it be as a doctor patient or as a brother to a sister or a husband to a wife. Just have the understanding of what they're going through. Believe them when they tell you what they're going through, and help them out the best they can, because that is the best support that you can give.
This has been Average Joe. Let's talk about it. Usually around here, we're talking about the things that raised us, made us laugh, and made us who we are. But every once in a while, we need to talk about something simply because not enough people are talking about it. This was one of those conversations. Listen to the people you love. Believe them when they tell you something is wrong. And sometimes, just being willing to understand is a pretty damn good place to start. I'll see you next time.